Well, the province is announcing some changes to addiction and mental health supports today. CP24 has learned this morning that several safe consumption sites are going to be closed across this province, and this is based on their proximity to schools. The Ford government will be committing some new money to fund more treatment and support options. Ontario launched a review of all safe consumption sites last summer following the shooting death of a mother near the South Riverdale Community Health Centre in Leslieville. For reaction to this now, we're joined live by Jillian Kola, Assistant Professor of Population Health and Applied Science at Memorial University in Newfoundland. Appreciate you joining us this morning. What is your reaction to finding out that some of these sort of safe consumption sites are now going to close down based on their proximity to schools?
Thanks, Nick. I think that my main reaction is one of extreme concern. It's very, very unclear why the Ford government is pursuing this move right now. They haven't released the results of the review that you just mentioned. And most importantly, we're in the midst of a very, very dire public health crisis in Ontario. Ontario has the highest number of overdose deaths in Canada. For 6 years now, the Ford government has been promising more supports, more treatment, and nobody disagrees that treatment is necessary. We should have easy access to evidence-based treatment. They have not done that in the last 6 years, despite many, many provinces. And now they're talking about closing services that quite literally are intervening in thousands of overdoses every single year. If they do pursue this, it will be absolutely devastating. South Riverdale Community Health Centre, the one that you keep on showing there, has intervened and saved 1,000 lives from overdose since they opened. That is a tremendous amount of intervention in a public health crisis that we will be losing.
Now, in confirming on the one hand, the province saying that those are going to be shut, some of them are going to shut down based on the proximity to schools. The province also says they are committing, or it is committing, new money to fund more treatment and support options. I suppose the devil is really going to be the details about what that looks like, though, isn't it?
Yes, what has been released so far, and again, this is somewhat rumor and innuendo, I'm interested to hear what Minister Jones announces this afternoon, is in the order of 375 supportive beds. That is not going to make any difference when we have close to 3,000 people dying of overdose from a toxic drug supply in Ontario every year right now. It's a drop in the bucket. We need to have both harm reduction services like supervised consumption sites, which intervene and help people who are continuing to use, and also provide crucial referrals to treatment and other health supports. Those two things work together. We need supervised consumption sites, harm reduction, and treatment, a comprehensive system of care. And pulling away one aspect of that without any evidence whatsoever, based on quite simply fear-mongering, we're going to have a very, very detrimental effect. And quite simply, it's going to cost lives in this province.
Yeah, it sounds to me like you think this has turned into more of a political issue rather than a public health or public policy issue here, and squaring that circle is going to be a challenge. Is that a fair assessment of your understanding, or how are you feeling about this?
100%. Nobody disagrees that we need good quality access to evidence-based treatment. Everybody who wants access to treatment should have access to treatment. The sites that are being closed based on this announcement are actually one of the main places that people are getting referred to treatment when they are interested in going. The problem has always been huge wait lists for treatment, a lack of evidence-based treatment in this province, and we should really be focusing on increasing what we know works. We know that these sites have actually reduced overdose mortality in the neighborhoods where they have been put in place. And so we need that alongside treatment. We need to be increasing access to services, not taking anything away.
You cited the number about the South Riverdale Centre about sort of saving 1,000 lives approximately. Do you have a sense then, Professor, about what that number would be that you think would satisfy, would meet the sort of wait lists and the urgent need of some people to sort of either help get them clean or help them use drugs more safely, if that's possible?
I think the interesting thing is that there is a variety of different treatment options, and some are going to work for some people and others are going to work for others. So we need, for example, easy access to evidence-based opioid medication treatments, opioid agonist treatments like methadone, buprenorphine, as well as safer supply options. We also need supervised consumption sites. We've never actually scaled any of the treatment or harm reduction measures to the level of the need. Again, we have 3,000 deaths in Ontario every year right now, and we have hundreds, if not thousands of people on wait lists for treatment. That does need to change. But cutting back on services that literally see thousands of people every day. They're talking about closing 10 sites across the country, or across Ontario, including the only site in all of Northern Ontario in Thunder Bay, after having refused to fund sites in Sudbury and Timmins that were operating and providing much needed services in areas of the province where the per capita death rate is double what it is in southern parts of Ontario. So right now, this is going to be so detrimental and destructive to efforts to save people's lives and connect them to health and social services.
Okay, we'll have to see what the health minister comes out with later this afternoon to get some more details on this. In the meantime, Jillian Kola, Assistant Professor of Population Health and Applied Health Sciences at Memorial University, do appreciate your time and insight this morning. Thanks for being here.
Thank you for having me.